In March, we went to Manhattan for a Rangers game, and while we were there, I got sick. We called an ambulance for me while we were in the hotel there, and they brought me to a different hospital. While I was there, they diagnosed me with bacteremia, which is an infection of the blood. After about 2 weeks there, the infection was spreading to my heart. At that time, they were advising me that I wouldn't be able to have any surgeon work on me, that no surgeon would be willing to do it, that they could not do anything, and that I needed to have my family come and say goodbyes and stuff like that. I want to say I didn't believe them. I thought that maybe no matter what, that I would be able to beat the odds. We decided that I would try to reach out to Dr. Kumar, who did my first heart surgery in Stony Brook in February of 2022.
She had the original operation in our hospital about 2 years ago. She recovered well from that. Somehow she ended up having reinfection on that valve, but this infection was really roaring.
She had been given a risk of mortality of about 80% or higher. And when we heard about her, we had the opportunity to speak to her cardiologist who was caring for her there and got some data. And we used that data and plugged it into what's called the STS risk score. What we got was a risk of death of about 20%. We thought it would be reasonable to offer her surgery. We repeated her echocardiogram, which is an ultrasound of the heart, which showed that this valve of hers that had been replaced some years ago was once again infected and was leaking and obstructed. Part of it had separated from the space in the heart where it had been sewn before. With Dr. Kumar, once again, we took her to the operating room fairly urgently. So we took out the old valve. We cleaned up all the infected material. And then we had to use something called a pericardial patch to close the pockets of pus that she had so that once again there was a safe place to put a new valve.
So it was a major reconstruction. Operation took about 12 hours almost.
One of the things that happened, probably as a result of the debridement and cleaning up we had to do for her aortic valve, is that her mitral valve, which is a second valve that sits right beside the first one, became a little leaky. Our structural heart team was able to do a percutaneous repair of that leaky mitral valve.
The heart failure team put in a device called a CardioMEMS that monitors the fluid in my body so that I don't ever have an issue like that again where I get fluid overload. And then I got discharged at the end of May. About 3 months after the surgery, I started cardiac rehab, and they set me up with an exercise plan. So if it was difficult, they would dial it back a little bit, but if it was too easy, they would dial it up. Now I'm starting to go back to work. I'm able to drive again on my own. I'm able to go up and down the stairs. We're able to go outside and be physical, which was something that I really missed when I was in the hospital. Overall, besides just physically feeling much happier at Stony Brook, the entire cardiac unit, they completely saved my life in more ways than one, and I could never express all my gratitude. Dr. McClarty is one of the most incredible women that I've ever met. I couldn't believe when I met her. I was so blown away.
We are different from other institutions. We look at patients, their conditions, and their recovery and their well-being. Doesn't matter whatever the expense is, how long they're going to stay. We don't look at all those things.
If somebody gives you the definite prognosis that you would like to fight or you don't believe is accurate, I would give Stony Brook a shot because they changed my life.